Hello, today in this video we are going to talk about the step-by-step procedure of a CPR, that is cardiac pulmonary resuscitation. So first of all, let's see the position in which we have to keep the patient. First of all, make the patient to lay down in supine position on a flat surface or on the ground, and remove any crowding or gathering of people around him so that he can have access to fresh air. Secondly, we have to check for the vital signals of the patient, that is his breath and pulse rate. So for checking the breath, we have to keep our ear near to his chest and nose in this position like this, and hear the sounds of breathing. If we cannot hear any sound of breathing, we have to go for the pulse rate. So for checking the pulse, we have to check the pulse by the carotid artery using 2 fingers and keeping the fingers on his neck and checking for the carotid pulse. If we cannot find any pulse, we have to check the patient for any consciousness or responsiveness. So we will check the patient by his body and say, hey, can you hear me? Hey. So in that position, if patient shows any responsiveness, or he shows any consciousness of your attention, that's okay. Otherwise, we will proceed for the CPR. Now for starting CPR, first of all, we have to sit in the kneeling position like this and lock our palms one on another in this position and make our elbows straight. These elbows should be straight and not even slightly bent. After making this position, we have to keep our palm on the mid chest above the sternum bone of the patient and give 30 cycles of chest compressions. We have to give 30 chest compressions like this: 1, 2, 3, 4, 5, 27, 28, 29, 30. After giving 30 chest compressions, we have to hear again for any breathing rate. So as we cannot hear any breathing rate from the patient, he is still unresponsive, so we will give rescue breath to the patient. So for giving two rescue breaths to the patient, we have to tilt the patient heads with one hand and close the nostril of the patient with another hand and give 2 rescue breaths. These rescue breaths should be given on mouth to mouth pathway. After giving rescue breaths, we have to again observe any vital signals of the patient. So as we can observe, there is no breathing or any pulse rate. So we have to repeat this cycle again and again until any emergency help or ambulance arrives, or somebody else can take your place and give CPR to the patient. That's all. Hope you like this video and understood the procedure of CPR.